If you had a kid coming in that was labeled autistic, how would you get a hearing test in a kid like that? He may not want to sit. Certainly not going to answer your question if he's not speaking, or at least not speaking. How would you approach a kid like that to do a hearing test?
Okay. Well, we would try everything that we try in a child who's not autistic. We would try the computer-based tests, and very often they will be willing to sit if we give them, I don't know, stickers or a lollipop, or if they're in the arms of a parent who they feel comfortable with.
Win them over a little bit.
Sometimes we'll try to do that with every child pretty much, but sometimes they will let us. Then again, there are children who really are tactile defensive and won't let us near them. What we'll do is we'll bring them into the test booth, and we'll do the kind of testing that we do for children between the ages of about 7 months and 2.5 years old, which is called visual reinforcement audiometry. The child is sitting in the booth on their parent's lap, and we teach them that every time the sound comes into the room through the speaker or a headphone, if they allow, a little toy lights up and starts to play in the corner. And it's a conditioning response. The problem with some children who are diagnosed, many children who are diagnosed with autism, is that they tend to tune out auditory stimuli. So sometimes we're not able to continue and to finish the test that way. Children who don't let us do any of it, or who are unreliable, uncooperative, non-compliant, or untestable in any of those ways, sometimes do have to be sedated for the brainstem tests that we discussed earlier, in order to be able to conclusively rule out hearing loss as a
When they sedate them, it's just as reliable?
Oh, yes, absolutely.
So in other words, last resort gives you good, because sometimes a kid's not speaking and has been labeled autistic, they still could have a hearing problem.
As a matter of fact, there's one child that so stands out in my mind that I've never forgotten. She was referred here at the age of about somewhere between 18 months and 2 years old from one of the early intervention programs that conducted an evaluation and was on the verge of giving her a diagnosis of PDD. She came here, and it turned out she had a maximum conductive hearing loss, which was related to a chronic buildup of fluid in both ears. She went to an ENT, she got tubes in her ears, and not 2 weeks later, nobody was talking about that diagnosis anymore. Hearing loss, even temporary, even treatable, even transient, can be very, very isolating. And the way that a child behaves who's walking around long enough with that kind of hearing loss can look like a child with a diagnosis of PDD or those kind of characteristics. They're not responsive, they're not engaging. That's not unusual or uncommon.
I had a kid who was brought to me 20, 30 years ago, labeled autistic by a very famous pediatric neurologist at Columbia Presbyterian. To put the kid away. That was his attitude. They came to me from Philadelphia. He had every sign of a kid that should be normal, except speaking. And when the parents brought the kid to me, the first thing we noticed was that the kid was getting me to do things. He was trying to get me to give him a lollipop, trying to get me to do. I said, this kid is speaking, not with words. Mm-hmm. Let's do a hearing test. It was normal. You're near Philadelphia Children's. There's a very good speech pathology department. I'll make you a deal. My fee today is a bottle of ketchup. He said, what? Yeah, a bottle of ketchup. He said, you come back to me in 3 years. If you do everything you should do, get the kid to learn to go to a good speech pathology program, and the kid's in a normal first grade class, you'll come to me with a bottle of ketchup. 3 years went by. The kid was in a normal first grade class. He says, what's the bottle of ketchup about? Well, I'm going to tell you. Let's take that consultation from that neurologist, pour the ketchup on his consultation, and make him eat his own words. Because if you put the kid in an institution, the kids were autistic in those days, I think the kid would have grown up like an autistic kid. Mm-hmm. We act like the surroundings, and the kid would never have got stimulated, because those days it was a warehouse that did nothing for the kid. Mm-hmm. So my most famous patient that I'm the most proudest of, my fee was a bottle of ketchup.
Good for you. That's great. That's a great story about the